Hypothalamus artificial intelligence. Digital transformation powered by real-time autonomous and intelligent algorithms. Presents its solutions for Pandemic Management Decision Support System. Part 2. SEIMR RS. Multi-infected states, multi-socio-demographic segments, and multi-region mobility, epidemic model. The presentation consists of 5 videos, and their supporting documents, which summarize all the applied research work carried out by HI, to contribute its knowledge in highly complex mathematical modeling, to the optimized management of pandemics such as COVID-19. These are: Pandemic Management using Advanced Artificial Intelligence, Epidemic Simulation Model, General Epidemic Optimization Model, Epidemic Economic Impact Model, and Kalman Filter Estimation Model of the Epidemic State. The models corresponding to Part 4 and 5 are designed, but have not been implemented. Users of these mathematical models can be grouped into information technology companies, government, universities and research centers, and private enterprises and gremial organizations. The result of the research and mathematical models carried out by Hypothalamus Artificial Intelligence, it is considered a public good, because it is of benefit to all humanity. Therefore, HI is willing to offer them at no cost to nonprofit organizations, mainly in developing countries. HI is also interested in being part of research groups working on pandemic management. Conference prepared and edited by Jesus Velasquez Bermudez. His resume can be found on LinkedIn. The decision-making during the pandemic process aims to make the best decision for society, which is not easy, nor intuitive. The problem is further complicated, when decisions must be made with real constraints on available resources, and when it must consider the socio-economic impact, derived from the pandemic and its control. The traditional goal of pandemic management focuses on modifying the natural behavior of the pandemic, solid curve, through sanitary controls, in order to reduce the peak of infected people, striped curve, and thus save lives by reducing the deficit of hospital resource capacity. However, it should be noted that the two curves have the same integral, and in theory when time tends to infinity, the amount of the infected population will be equal. If hospital resources are sufficient, there is no reason to delay the peak, and as the pandemic spreads, the negative socio-economic impact will be greater. The traditional tool is to use simple epidemic simulation models, trying to predict the future of the pandemic, before different control measures, and thus select, based on perception, which is the best decision. When all the models that make up a company are solved using the concepts of real-time distributed optimization, an artificial hypothalamus is obtained. In the case of the epidemic, HI has conceptualized the epidemic management hypothalamus based on 4 models: epidemic model, logistic model, economic model, and control and surveillance model. This video is related with the epidemic model. Pandemic process modeling. The traditional objective of pandemic management focuses on modifying the natural behavior of the pandemic through medical and health controls in order to reduce the peak of infected people, ignoring the negative socio-economic impact on society. The quantitative goal of epidemic control strategies is to reduce R0, the basic reproduction ratio, to reduce the demand for high medical services, HMS. This can be achieved by reducing susceptibility, or contact rates, in the population, or the infectiousness of infected populations. The potential effectiveness of medical intervention, by varying the infectiousness of infected populations, and non-medical interventions, by reducing the contact rates must analyzed. In medical intervention, use of vaccines and antiviral agents for case of treatment can increase the recovery rate, and reduce the death rate. If there are no vaccines or antivirals, only non-medical interventions remain. In non-medical interventions, reducing population contact rates through social distancing and travel restrictions can reduce the impact on the transmission process. There are multiple factors that affect the shape of the natural curve of the epidemic. Here are some examples. The graph presents the natural curves for different regions of England. The graph presents the effect of seasonal changes in transmission rate, assuming a reduction in transmission over the summer. The table presents the impact of the epidemic varies, depending on the age of the patients. On the other hand, the The theoretical impact of different non-medical control policies has also been studied. The graph presents the impact of 5 measures that can be taken: do nothing, isolate cases of infection, quarantine in homes, close schools and universities, and control the minimum social distance. Contacts by day of week. Contacts by region. Based on the above parameters, it is easy to verify that a cosmopolitan region does not fulfill the homogeneity in the behavior of the areas in which it can be divided. This means that in the region there are as many pandemics as there are basic areas that the city may have, in the extreme as many pandemics as buildings, or groups of buildings. This implies that a simple model, which sees space as homogeneous, is not able to produce results that are close to reality, and therefore does not seem to be an appropriate quantitative tool to support public health decisions in large cities or conurbated regions. SEIMR-RS, General Epidemic Model. SEIMR-RS model has been published in the special edition of the European Scientific Journal, Public Policies in Times of Pandemics. The document, SEIMR-RS, General Model of Simulation of Epidemics, Multi-Infected States, Multi-Socio-Demographic Segments, Multi-Region Mobility Theory, corresponds to the model of differential equations for the simulation of pandemic processes. Contains the detailed formulation of the SEIMR-RS model. SEIMR-RS corresponds to a generalized mathematical model of pandemics that enhances traditional, aggregated simulation models when considering interregional impacts in a macro region. SEIMR-RS also considers the impact of modeling the population divided into socio-demographic segments based on age and economic stratum. It is possible to include other dimensions, for example, ethnics, gender, etc. SEIMR-RS is the core of the SEIMR-RS OPT Epidemic Management Optimization Model, that determines optimal policies, for example, mitigation and confinement, considering the spatial distribution of the population, segmented socio-demographically. SEIMR-RS can be understood and used by any epidemiologist, and/or physician, working with SEIMR or similar simulation models, and by professionals working on the issue of public policies for epidemic control. SEIMR-RS was carried out in a Java program. This program may be used by the organizations that considers the SEIMR-RS will be useful for management the COVID-19 pandemic. The SEIMR-RS is a detailed epidemic model, that is the result of integrating the SEIMR and SEIRD models. In these standard models the population is grouped in only one homogeneous group. SEIMR-RS extends the modeling to a multi-segment socio-demographic multi-region system. SEIMR-RS model describes the epidemic with following states. S. Susceptible, initially covers all population that potentially can be infected. E. Exposed, population that has been infected and are in an incubation period. The model SEIR does not include this state. In multi-infected, population that has been infected and is active the pathogen in different states of development. The active infected states are ordered according to the severity of the infection. The modeled SEIR and SEIR consider only one infected state, and are recovering population, RS is related with a region segment model that considers multiples regions where live people classified in multiple socio-demographic segments. It is based on simulation models of low mathematical complexity. The table presents some of the models traditionally used for pandemic simulation. They are all similar, based on a small set of differential equations, and applied independently for a region without considering socio-demographic characteristics. The general assumptions for SEIR and SEIR models are: no vaccine exists, the susceptible population is reduced through infection, moving to infective state, people who recovered after catch the virus will be insusceptible of it, the population of infective class is increased by a fraction of susceptible individuals becoming infective, all other people are susceptible, the population is homogeneous, and the population of critical infective individual. The susceptible infectious recovered model, SEIR, introduced by Kermack and McKendrick in 1927, is the basic epidemic model. It describes the pandemic based on three states for a person: susceptible, infectious, and recovered, based on a system of three interrelated differential equations. This state transition diagram of the SEIMR model enriches the original description, including three additional states: NP, new population arriving, ND, natural dead, and ED, epidemic dead. Then, the differential SEIMR equations must be adjusted, including two additional equation and one parameter for the new population. The table summarizes the equations that are part of a regionalized and socio-economically segmented SEIMR model. The SEIMR model is an evolution of SEIMR model. It includes one additional state: X, exposed population, with its corresponding differential equation. The transition between infected states follows these assumptions. The SEIMR model was used by the Mayor's Office of Bogotá to manage the COVID-19 epidemic. A person can only be infected by one of the individuals belonging to one of the infected states: I0, I1, I2, I3, hasta IN. Thereafter, will be used the index street to indicate the level of infection. Being inoculated by the pathogen, the individual passes to the group of exposed X. After the latency period, the person in the exposed state becomes asymptomatic infectious, I0 state. Once the person is in first state, there are two possible outcomes: worsening clinical status moving to next infected state, IST+1, or to recovery, RE. If the person recovers, in any of the states of infection, they enter the absorbent recover state, and similar logic applies for a larger number of states of infection. It is understood that, if an individual of the last state of infection worsens, its clinical condition will be death by the epidemic, ed. The table shows the biological parameters of the SEIMR model. The SEIMR equations of the dynamic model described previously symbolize the proportion of individuals in the population in each of the states: S, E, I street, R and D. The following table summarizes the equations included in the SEIMR model. The equations have been divided into increases and decreases of impacts in the ST state. The image shows the characteristics related to the epidemic states included in the three models. Epidemic high complexity modeling. The map corresponds to a city of 8 million of inhabitants, which is divided, at the first level, in 19 localities. Two alternatives exist to model the pandemic: as a single region, or as 19 regions that interrelate during the pandemic. The traditional approach is an aggregate or top-down modeling, that is a low mathematical complexity tool. In this case, the way is to apply a simple epidemic model to the entire city. The simplicity of the approach suggests that Excel is a suitable tool to solve the problem of pandemic management. But, this is very far from the state-of-the-art of mathematical modeling. To estimate the aggregate behavior. The next step, since a better visualization of the spatial distribution of the pandemic is required, is to perform a disaggregation for each of the atoms, that are the basic areas. The disaggregation is empiric, because it is based on subjective rules, which do not reflect what is really happening in the territory. The detailed or bottom-up modeling is a high mathematical complexity tool. It is based on the detailed modeling of each of the atoms and their interrelationships. From the atoms, and considering all the interrelationships, the pandemic is simulated in such a way that it reproduces the behavior of the pandemic in each atom. The next step is the scientific aggregation of results, to explain the behavior of the entire system. This procedure is totally objective, and produces a realistic evolution of the pandemic. The modeling implies that the SEIMR-RS model receives as input the detailed description of the city, and produces as a result, the detailed simulation for each area in which the space has been divided. The mathematical complexity that must be handled is reflected in the number of differential equations that must be solved. In the case of Bogotá, if the city is divided into neighborhoods, equations would be 738,048, and it requires high-performance computing resources to solve the problem. This contrasts with the three equations of the SEIMR model for the whole city. SEIMR/RS. General Epidemic Model. Multi-infected states, multi-socio-demographic segments, and multi-region mobility. The SEIMR-RS model is built on the basic equations of the SEIMR model, including the effects of considering the development of the epidemic in a territory that includes multiple regions, in which the population socio-demographic segments are distributed in a non-homogeneous manner. Including regional and socio-demographic segment modeling, for example, age and economic stratum, involves associating the biological parameters with these aspects. Therefore, biological parameters may be related to indices, RG, region, SS, socio-demographic segment, EG, age, and/or say, economic stratum. Regional modeling. To formulate the interregional model, the following hypotheses are assumed. There is no direct contagion between people living in different regions. The inter-region relationship is modeled based on the following assumptions. There is traffic of people between regions, which sets for each pair of regions the fraction of each segment, moving from the source region, ρ, to the destination region, RG, and it is known the fraction of the time that people from the origin region spend in the destination region during the period. The calculation process determines the impact that the population movement has on the spread of the virus. For this purpose, it is calculated using the number of infected people who can move between two regions multiplied by the fraction of the time spent in the destination locality. This implies the following effects on the diffusion rate. Infected movements increase the rate of diffusion in the destination locality, due to those infected by coming from other regions, and decrease diffusion rate in the source region, due to the infected by moving to other regions. The equations are presented in the image and explained in detail in the original paper. Susceptible movements increase the rate of diffusion in the destination locality, due to those susceptible people by coming from other regions, that may be infected in destination region, and decrease diffusion rate in the source region, due to the susceptible people by moving to other regions, that cannot be infected in source region. The table shows the parameters associated with interregional modeling. The image presents equations of the SEIMR-RS model, in algebraic form, typical of mathematical programming. Other algebraic equations of the SEIMR-RS model. Socio-demographic segment modeling. An infected person in any segment can infect anyone susceptible, in any socio-demographic segment. The calculation process implies that at the level of one region, the population of any segment can infect the population of any other segment. To do this, diffusion, infection of susceptible by infected, is managed at a detailed level for all infected states, but in the differential equation the infected transmission is calculated based on the summation of all infected states in all SS segments. In traditional aggregated models, the transfer rate, the inverse of contact intensity multiplied by the transmission probability, is assumed fixed for all region, and all socio-demographic segments. In SEIMR-RS the transfer rate depends on the socio-demographic segment in a region. This parameter must be calculated by the parameters model. The differential equations of the regional segmented model are presented in the image. The algebraic equations of the regional segmented model are shown in the image. The table shows the biological parameters of the SEIMR-RS model. The table shows the biological parameters of the SEIMR-RS model. On the other hand, all the socio-demographic data of each atom, or area, must be collected. Part of this information must come from the regional database of the Public Health Authority, and other part is calculated using the read parameters. Below are showed some of these parameters. More detailed information about high RPO can be seen the video. Integrated regional planning incorporating economy, logistics, infrastructure, and land use. Economic equilibrium city-region. SEIMR-RS is based on detailed modeling and high mathematical complexity. For example, in a city like Bogotá, Colombia, with about 8 million inhabitants, using a traditional model to explain the behavior of the pandemic is very risky, and certainly will not lead to the best decisions. This is because the behavior of the pandemic, in the different areas of the city depends on its socio-demographic characteristics. The solution is regionalizing the process, considering, at least, that the city is divided, administratively, into 19 locations, 113 zonal planning units, UPZ, and 1922 neighborhoods. Association of the areas of the city to the economic strata. Characterization of city areas based on population density. The table shows the demographic economic segments included in the database. The tables show the basic entities used to model socio-demographic economic segments. 3 dimensions of segmentation are considered: race, income and age. The table presents the segments considered, which arise from the combination of the elements of the segmentation dimensions. Biological parameters. These parameters are fundamental to explain the evolution of the epidemic. It is traditional to assume common parameters for all regions of the territory, but it is not correct. It is possible that the pandemic is linked to an already known virus, in which case there should be realistic estimates of these parameters. The case of COVID-19 corresponds to a new virus, for which at the beginning of the process the value of the biological parameters is unknown. Therefore, predictive analytics models are required that begin to work from the moment the virus is detected, so that from automatic learning processes they generate the best unbiased estimators for each of the regions. HI proposes to use the SEIMR/RS/Kalman model, which should be ready for the first day of the pandemic. Therefore, its implementation must be carried out in the pre-pandemic stage. The table presents the states in which people may be during the pandemic process. For each of them, biological parameters must be defined. The table presents the biological parameters of the regionalized and segmented SER model. These parameters must be characterized for each segment in each region. Below are examples of biological parameters, estimated with a simple predictive analytics model, a linear regression, taking as reference the data reported for a city during the first days of the COVID pandemic. The parameters correspond to common parameters for the whole city, due to the non-existence of regionalized observations. It should be borne in mind that when estimating the parameters from the event, and not in laboratory conditions, they will be affected by the factors that impact the epidemic in the real world. It should be noted that the fall of the curve for people over 60 years of age seems to be inconsistent, due to the sample studied that may be affected by protection especially aimed at the elderly. Therefore, with the help of experts, methodologies should be introduced to eliminate erroneous data, for some valid reason. In this case, it is simply assumed that from 40 years the curve follows a constant slope. The age versus critical recuperation function is presented in the graph. In this case you can notice outsider data of the curve, which could be eliminated to improve the estimators. The first point to be eliminated corresponds to the age of 0 years. This implies an improvement in R² from 0.38 to 0.45. The next points to be removed correspond to the ages of 30 and 35 years. This implies an improvement in R² from 0.45 to 0.72. This process is subjective and depends on the criteria of the data scientist. In this case, the shape of the curve is maintained, and estimators with less uncertainty are obtained. The age versus contact function is presented in the graph. The age versus complication time function is presented in the graph. The age versus recuperation time functions is presented in the graph. There are several graphs, one for each level of infection, I0, I1, I2 and I3. The parameter models, biological and socio-demographic, come together to feed the finite difference model, which can be implemented in any programming language, including algebraic languages oriented to mathematical programming. Hypothalamus artificial intelligence. Invites to join to the LinkedIn group. Mathematical modeling for coronavirus pandemic. Like Herbert Simon, Hypothalamus AI believes that the computer-based mathematical modeling is the greatest invention of all times. Thank you for your attention.